Good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. Paul Thomas and Bill Kearney back in the studio after a week off, and Bill traveling to Wisconsin.
Yeah, Madison, Wisconsin.
Took off and
had a board meeting and got there, and it was raining, and it rained every day I was there, but it was kind of like Hawaii. It didn't rain all the time, but when it rained, it really came down.
rained hard, yeah.
And we were building a new office building back there, and we were just trying to get it dried out enough that we could pour concrete. And the last day I was there, we were able to pour the concrete, and it was a dry day, not a humid day, and it dried. By the time I left at 3 o'clock, it was they were already making the indentations in the concrete. So then trying to get back was a little different story. I had
every time you travel,
I know.
it's like you get caught in the airline blues.
I got ready to get on the plane to Salt Lake City, which was my anchor place, and that flight was canceled, and they didn't reschedule it. And here I am in Madison, Wisconsin, and I'm trying to get back to Sacramento by 10 o'clock at night. And so they got me, sent me up to Minneapolis. And I sat there for 4 hours and finally got down to Sacramento and called the hotel where my car was. And they said, well, we don't have any shuttle service after 6. I said, well,
not, yeah.
When I left, you told me that just to call you and you'd pick me up. Well, that was during regular hours. So anyway, I got home at 8 o'clock the next morning or 9 o'clock, and then I changed clothes and came back and worked the car show. And then I went down to San Francisco the next day when my grandson was chosen to go out and yell play ball.
Yeah, that's cool.
So we all went down on the field, and Bradley's 8 years old, and he's really cute, and he's very shy. And the vice president of Good Neighbor Pharmacy, we had a pre-party ahead of time, and he said, Bradley, I want you to say play ball. And he says, play ball. And he says, no, I need you to step it up a little bit louder. And he said, play ball. He said, Jeff said, no, come on, I want it a little bit louder. And he screamed it out, and then he got down on the field, and this little giant cheerleader was down there with her arm around him, helping him, and asked him to yell play ball, and he screamed it out. Because, of course, his picture was up on the big jumbo board, and said Bradley Williams from Ferndale, California, from Good Neighbor Pharmacy and North Lake Pharmacy in Lakeport. And we had a great time. It was a beautiful,
really cool.
Beautiful day down there, and got out of there without a huge traffic jam. And it was a great experience for him and his family. And we had one of our other grandsons was able to do that 4 or 5 years ago down there. And it's sponsored by Good Neighbor Pharmacy, which is our wholesalers PVA, and we do put a lot of money into advertising in the Bay Area. So if you ever watch Marty's or listen to Marty's show before the ball games, we're always a major sponsor. So this was one of the. Then we got socks from Krupp and Kipe, that had Good Neighbor Pharmacy on it. I don't know when I'll wear them. Probably hunting or fishing or something. They're a little bright, but
was it a sock giveaway day?
Yeah. It was
very cool.
First 20,000 got them, and we didn't know what line to go in, and I says, "Is this a special line? You guys are going in early." And this lady from England said, "Well, it's special because I'm here." And I said, well, why are you here? And she said, well, to get the socks. And I said, well, I'm paying for the socks. Do you think I could go in first? So anyway, we got up there, and it was a great time and a great fun, and got to see a lot of the Bay Area Good Neighbor Pharmacy owners, and now we're back here and talking about your health, and lots to talk about, lots of different things going on in the country, and some of the things that we're going to be talking about is really how to make lifestyle changes before you take medication, and you think that's probably unusual for a pharmacist to be talking about. But life is changing, and we have to accept the changes that are going on and see where we think, because of our health care, that we're going to be paying more and more for a lot of things, and whether or not we can afford them or not, because we really don't know what kind of a health care plan we're going to have. It varies from day to day and from party to party, and whether or not the insurance companies and the pharmacy benefit managers can make money or not is a huge issue. So, and then we're going to talk about the health effects of probiotics. Almost every day we have somebody come in and their physician has asked them if they would mind taking a probiotic, especially if they're taking an antibiotic. And that's something that we're going to talk about. How valuable are those, and have the rules changed on probiotics from having to take a live product instead of something that you can just take off the shelf. And a little bit of my experiences in Asia when I was in the military in Vietnam and Korea about fermented products and why they were healthy for you and still are healthy for you, and they continue to do those kind of things. We're also going to speak about why more young people are dying of colon cancer and what we can do about that. And one of the fun things we're going to talk about is the watermelon that's out there, the health benefits and risks, and whether the nutrition is justified and verified that it's a really healthy product for you, and plus other things that are in the news that we're going to try to discuss. So our number is 263-5252. That's 263-5252 if you have any questions you'd like to ask us. Anything that is going to be significant, answer your health questions. If we don't have the answer, we will certainly get it to you. We would like to start out by mentioning that flu vaccines are going to become available probably within the next month. We will be advertising that. We'll be sending out some postcards. A lot of people are asking about getting flu shots right now, and I understand there are some of our competitors that are giving flu shots now, but you need to understand that vaccine has to hold you through flu season, which goes clear up to April of 2018. So the earlier you get them, the more the protection dies out during the length of time that from when you've taken it until the longer you have it, the intensity is not as great. So we suggest waiting till late September or October to get the vaccine. But a lot of people want to get it now, and we won't be getting our shipments in until probably the middle of September. But you will know as soon as we're getting those vaccines in. We don't know what kind of a year it's going to be. We always guess on the strains that are going to be active. We're doing a quadrivalent one this year, which is more potent, and it's all covered by insurance or by Medicare or by Medi-Cal or Partnership Health. Most every insurance will pay for flu vaccines. That's not true of all vaccines, and a little bit later on, if we have time, we'll talk about vaccines that people should be getting before they go to college, which is imminent. Some people are in college right away. The other thing we need to renew is the Healthy Kids Vitamin Program. If you were on that, those are free vitamins you get by coming to our pharmacies, filling out a small documentation, just saying what children you have, and you're going to have a punch card that will tell you that you've picked them up in September or August or whatever, and you can do this for 2 years. And and they don't cost you anything. It's a free month supply of vitamins for your kids. And all you have to do is fill out the documentation, and we give you the vitamins. A lot of the schools will have the documentation for you to fill out. If they don't, come into our pharmacies, and we will have them. We do a lot more of that at Hill Road or at the Bruno's location than we do at Hill Road, but they will be able to get the documentation as well as ourselves. So those two things are active, and we hope that you utilize those things that aren't going to cost you anything and are going to prolong your health. One of the things that we started talking about in the beginning were things to try lifestyle changes before you take medication. We're going to talk about 12 different situations. One is ADHD, which is a attention deficit hyperactivity disorder. The big things that people are using now are antipsychotics such as Abilify and Seroquel. These drugs have a lot of side effects, and especially if it's a youngster, they include constipation, difficulty breathing, swallowing, dizziness, drowsiness. A lot of times behavioral therapy plus educational interventions and exercise work just as well, and sometimes a stimulant such as Adderall or Ritalin also may be necessary. And as you think of as an adult, those are amphetamines, and are they the greatest thing for kids? But they do help you focus. I'm really reluctant. I have a grandson that's autistic, taking some kinds of medications. In his case, it's verified, and we have medical, clinical evidence that that he needs to be on this medication. But too often, when we have a hyperactive grandchild or child, rather than us use behavioral therapy and be the disciplinarian that says we need to focus on this, we just say, let's get us drugs and let the drugs do it. And many teachers, and I'm not bad-mouthing any specific teacher or anything else, but it's a lot easier for a teacher to have somebody on one of those medications so they can focus on what they're doing than try to discipline the individual. My autistic grandson, I took him down to the Giants game. He's 10 years old. There were times when the excitement of the game kind of got to him, and they do what they call stemming. One was he lost his cell phone, thought he did, and one of the things that keeps him very occupied are playing games. He's extremely intelligent. If he's designed games to play and levels to play on the computer, that's something that keeps him very active, and his vocabulary and his reasoning is way above what he would be, and normally at his age. So, and he's on medication on top of that, and we really don't like what the medication does, but it does some good things and has some side effects, and we go back to the same thing on risk versus benefit. And you have to evaluate that as a parent, as a grandparent, who, if you're responsible for a child like that, certainly look at other options in the beginning. Back and joint pain, we all have that as we get older, and there's non-steroidal and anti-inflammatories such as Advil and Aleve and Celebrex and opioids. I was just watching one of the national morning shows this morning, and they were talking about getting fentanyl out of China, and all this person did was just give his name as John Doe or something similar to that. I'm looking for fentanyl. It took China, 2 or 3 minutes to answer back. They wanted to know if they had it available. China said they did. They could get it to them. I don't know what the cost was, but there is an opiate crisis in this country and all over the world, and there's no way to catch these people sometimes if they're going through the internet. Risks, of course, high doses of long-term use of even the non-steroidal anti-inflammatories like Advil and Aleve and those over-the-counter ones, ibuprofen, can cause bleeding in the intestines, kidney failure, heart attack. Most of us don't take enough of the non-steroidal anti-inflammatories to have a problem. If you're like me and have had 4 back surgeries, I take Celebrex, which is a prescription product. I take half of what I'm supposed to take to keep the inflammation down. Am I in pain all the time? Yeah, I am. But enough that that I can't be ambulatory and I can't function? No. The other option is opiates, and those are high risk. They can trigger drowsiness, nausea, vomiting, constipation, addiction, and overdose. And unfortunately, or fortunately, we have a drug called naloxone now, which is given to a lot of people who overdose, and given to law enforcement, and given to families. So if the person that they're with takes too much of an opiate and they overdose and go into a coma, you can bring them out with naloxone in a nasal spray or an injection. And unfortunately, a lot of addicts are using that to not back off and take more and more of a drug. And when you buy it on the street, you never know what you're going to get. Non-drug options are yoga, swimming. I swim every day. Stretches, massage, physical therapy. If none of those things work, anti-inflammatories are all right for a short term. Even though you stick with a low dose, they don't want you to take them too long without letting your doctor know. And even though the over-the-counter non-steroidal anti-inflammatories we have aren't prescription dose, many of them, you can take multiple tablets or capsules and get up to that maximum dose. For ibuprofen, the over-the-counter is 200 milligram, but you can go up to 3,200 milligram a day with taking 4 of the 800 milligram tablets, and that's the max. But if you never talk your doctor and you keep doing that, eventually you're going to end up having some gastrointestinal or stomach bleeding. Dementia is what a lot of people get as they begin to age, and generally the same drugs as listed for ADHD, as well as a stroke and death, are used. The non-drug options are a regular routine to do calming activities and have frequent social contact. The worst thing you can do is isolate yourself when you start getting demented, and of course you need to know there are medications on the market for dementia, but the most they will do is take you back to what you were like 6 months ago. And before we realize that we're there, it's past the 6 months by a considerable amount of time, and taking you back 6 months really isn't doing you any favors, and there's side effects with those medications. If you're suffering from hallucinations and delusions or other mental illness, then of course you have to be on drugs. Mild depression, such as Celexa, Cymbalta, Lexapro, Prozac, there are side effects for that, and one of the problems or one of the situations that's happened with antidepressants is we have put people on serotonin reuptake inhibitors, which serotonin is a drug that makes you feel good, and we've gotten used to using those drugs and have gotten to the point where we don't really resolve why we had the depression to start with, and as long as we have the drug therapy, we don't deal with that situation. If that therapy alone isn't enough and depression is severe, then they put you on a medication, and unfortunately or fortunately, depending on your cause, you can be on it the rest of your life, or you can taper yourself off of it. One thing about these kind of drugs is you don't just cold turkey and quit taking them. Almost any drug, even one for heartburn. That's the next one, the heartburn thing. We've talked several times recently about the different kinds of medications that are available. The old Maalox and Tums thing, which is calcium carbonate to really cover the area in your stomach that's causing the irritation. And then the histamine blockers like Tagamet and Pepcid and Zantac, and then the PPIs, which are Nexium, Prevacid, Prilosec. There's always risk to taking those kind of medications. We've talked about those several times. Not going to spend a whole lot of time on it, except there's more and more information related to what we talked about before that. There's very little evidence to back up the fact that PPIs cause dementia now, although that's been something that's been reported in the press to great extent. Insomnia. As you get older and as stress takes a part of you, sleeping pills such as Ambien, Belsmara, and Lunesta you take to get you to sleep. The longer you take them, the less effective they are, and you become dependent upon those. You get next-day drowsiness, impaired driving, worsen sleeplessness when you try to stop, and that's something that you don't want to go through, but you almost always have to stop it at some point. If you're over 65, your insurance company is going to demand that you do something else. Non-drug options are cognitive behavior, where a provider teaches you good sleep habits excuse me, and suggests ways to change your behavior, like cutting out naps or not using your laptop in bed. I can't imagine doing that, but the amount of people I see with their phones or their laptops in bed is staggering. Low testosterone, a big effort to get people on testosterone. Their risks are blood clots in the legs and sleep apnea, increased risk of heart attack or stroke. Non-drug options are treat conditions that can decrease testosterone, such as diabetes or obesity. As we age, so your testosterone level is at a high when you're in the teens as a male. By the time you're 65 or 75 years old, there isn't much there. So getting enough sleep, alleviating stress, those can be ways to avoid the drug. Osteoporosis or bone density, at the low end of normal, we have the drugs Fosamax and Actonel. A lot of risks with those drugs, although we don't see them too often. When I was doing nursing homes, there was an effort for people, a lot of people were in there that were breaking hips and such, and so you gave them this drug first thing in the morning, but you propped their head up so it wouldn't dissolve in the esophagus when it was going down, and burn some of the processes in taking the drug. That has pretty much been eliminated. But if bone density shows you have full-blown osteoporosis, which is the softening of the bones, consider taking a break after 5 years to reduce the risk of lasting side effects. One of those is just an instant fracture. You need to take steps to prevent the falls by avoiding a lot of these drugs that are causing you to not be alert, and watch where you're walking. So an overactive bladder or the frequent need to urinate, again, these drugs are on the over 65 list not to take. Those drugs are called anticholinergics, such as Detrol or Oxytrol. Anything that cuts back on the central nervous system is considered a no-no with insurance companies, so you have to have documentation if you need those. The drugs are very effective. If you don't get enough result of cutting back on caffeine and alcohol and have bladder training, if several weeks go by and they aren't effective, they probably can get a prior authorization from your insurance company to get it paid for. Hypertension or blood pressure are at the high end of normal. A lot of people treat diseases such as diabetes and blood pressure as a precursor to really having high blood pressure or diabetes. ACE inhibitors or angiotensin receptor blockers, which such as calcium channel blockers and diuretics, can help whether or not your physician or your insurance company feels the documentation is enough to support it. Many times on these ACE inhibitors you can get a hyperkalemia, which means too much potassium, and they will take more lab tests in order to make sure that you're not accumulating too much potassium, which can affect the way your heart performs. And obesity, which has become an epidemic again in this country. The weight loss drugs used to be strictly amphetamines. Now it's Belvig and Contrave and Quiesima. You get constipation, nausea, and vomiting. They're very expensive. If you've been able to lose weight on your own by exercising and eating less, ask your doctor about these programs. Lifestyle changes, of course, are the very first thing that we should do. And if you haven't lost at least 5% of your weight after 3 months, stop because it's unlikely to help. The other thing is when you stop taking these medications and you start eating not to the extent that you did in the beginning, but you start eating less, your metabolism has taken a change and you start gaining back faster than you would have before if you don't implement lifestyle changes at the same time. So if it's a crisis and you need to stop, and I know several people, and I've fought weight all my life. The only thing that's worked for me is exercise. And sometimes when I overeat, I increase that exercise amount to over a half hour to an hour, and usually that's either walking on a treadmill, not running, because I've got a torn lateral meniscus, and that's very painful, or staying in the pool longer, and that works as long as it's summertime, and then at wintertime you have to pick up another option. So walking every day can certainly help. It's one of the things that we just have to force ourselves to do is the weather isn't good and you want to do something and you don't feel like it, and especially as you age, you wake up hurting, you go to bed hurting, and you wonder, why do I have to do exercises? And that's one of the things that we have to do to keep from hurting so much. We're going to take a break, and when we come back, we're going to talk about the health effects of probiotics and where they are now, and choosing wisely when you go to the doctor. Have you been reading, seeing, and listening to all the concerns about the cost of drugs and the cost of health care since the election in November? Hi, my name is Bill Kearney. My wife Dana, myself, and our employees have been bringing medication and medical supplies to our patients in Lake County for the past 38 years. Our efforts to convince the employers in Lake County that our services here are valuable to people like yourself have been mostly overlooked. As we continue to be a major sponsor of different entities and organizations in Lake County, please remember our support of your organizations. We love Lake County and all of you who have made this such a wonderful place to work and live. So the next time you get a new prescription or refill one of your previous prescriptions, come give us a try. I'm sure you will notice a difference. Getting a prescription from one of our pharmacies just might be one of the best parts of your day. North Lake Medical Pharmacy, with 2 locations, on Hill Road East across from Sutter Lakeside Hospital, or outside the Bruno Shop Smart in Lakeport.
This is the Caltrans Road Information Bulletin for Lake and Mendocino County State Highways for the week beginning Friday, August 18th. In Lake County on Route 20 near Stokes Court, expect 10-minute delays weekdays, and on the 22nd near Harvey Boulevard, expect 5-minute delays. On Route 29 from Hofacker Lane to Martin Street, expect 5 and 10-minute delays weekdays. And on 175 from Matthews Road to Arroyo Vista Road, expect 5 and 10-minute delays weekdays. In Mendocino County on Route 1 from the Westport North Bridge to the Wages Creek Bridge, expect a couple 5-minute delays. On Highway 101 at Ryan Creek, expect 10-minute delays weekdays. North of Long Valley Creek, expect 5-minute delays. And in the Dora Creek area, expect up to 40-minute delays, but less than that outside of weekday mornings. On 175 near the Lake County line, expect 30-minute delays. And on 253 near Singley Cattle Pass, expect 15-minute delays weekdays. That concludes the bulletin. Like us on Facebook for more updates and info on the type of work we're doing. That's Caltrans District 1.
The Potter Valley Garden Club meeting will be held on Wednesday, September 6th at 1:30 p.m. at the Pavilion at the Potter Valley Rodeo Grounds, located at 10747 Main Street in Potter Valley. They will discuss the present and future of the Parks and Recreation Organization of Potter Valley. If you're interested in joining the Potter Valley Garden Club, please call 671-5683 or 391-6346.
Raising your family, tending to your animals, growing your own produce, preparing for the seasons, living the country life. Hi, I'm Jody Henke, host of Living the Country Life. Catch me every Monday through Friday at 9:35 a.m. and 4:35 p.m. for ideas and inspiration for your place in the country. That's Living the Country Life here on AM 1270 and 96.5 FM KXBX.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you.
The Lake County Chamber of Commerce would like to recognize their Member of the Month Business Design Services. Robert Bocabella, BFA, is principal and founder of Business Design Services and is a certified interior designer in private practice for over 30 years. He provides designing to fit the vision in collaboration with writing service at earthlink.net. To contact him, call 263-7073 or email him at rb@businessdesignservices.com or visit his website at businessdesignservices.com or on Facebook at Business Design Services.
Lake County Chamber of Commerce, we're steady and strong, help us shape the future.
All right, we're back.
All right, Paul. No, not a quiz, but I want to know if you've ever taken probiotics, or do you know what they are?
I know what they are. I don't know what they are exactly, but they have something to do with regulating the digestive thing in your belly and so on and so forth. And I think I tried something once. I was looking online, and there was like supposed to be some, miracle cure for, to help you lose weight, and you're supposed to take probiotics, and this was back before I had lost some weight, a while ago, a year or so ago, year and a half ago, and it made me, I didn't feel well. It made me not feel well, so I didn't continue with it.
Yeah, you can get some digestive disturbances with it, and there's this whole thing started years ago when, in ancient times, when excuse me, people were using fermented products, which are live antibiotic or probiotics, to counteract anything that was going on within their stomach. And in the 1950s to 1980s, Europe was fantastic in starting that episode going. And then in the 1990s, the probiotics spread across the United States. But what happened in 1994, we've talked about this many times, but not lately, the U.S. Food and Drug Administration implemented the Dietary Supplement Health and Education Act, which allowed dietary supplements to be regulated under a different set of rules than prescription drugs, because all the time before this, they were trying to go to the Food and Drug Administration and get it approved. And because it was a natural product, the cost to do that and to put it in front of the FDA when it wasn't a prescription product was too much to go through. So there was a very long and expensive drug pathway through the Food and Drug Administration, but when the dietary supplement law got enacted, it opened a floodgate of unique probiotic products that weren't really probiotic. So in 2000, health officials cracked down on probiotics and said the guidelines recommended that the definition of probiotics be live microorganisms, which when administered in adequate amounts provide a health benefit on the person that took it. And around this time, various ways to administer probiotics and prebiotics which promote the growth of good bacteria in the gut emerged. There's now probiotics that come in chocolate probiotics and cheese and bread and little sprinkles you can put on ice cream. In 2010, there became a spotlight on the gut, which a systemic review paper in the journal Gut found that probiotics were helpful in treating the symptoms of IBS, or irritable bowel syndrome, compared with the placebo or no treatment at all. Yet, the magnitude of the benefit and the most effective seem to be uncertain which one to take. So there was 18 different trials that took place that were analyzed and published between the 1950s and 2008, which involved about 1,700 patients. That indicated that probiotics have a therapeutic benefit in improving irritable bowel syndrome, and future studies need to be done. So in 2012, the skyrocketed the use of that, with nearly 3 million more adults using probiotics, where in 2007 there was only about 865,000. So They ranked as the third most commonly used dietary supplement between fish oil and glucosamine and chondroitin. There's been a big thing on these probiotics, and the only difference is there are some probiotics that are they're good and some that aren't, and it's difficult to tell which ones are. But I want to tell you about the time that I spent in Asia, mainly in Korea, eating fermented food that has good bacteria in it, even though you would feel like it's not. I mean, fish, I was up on the DMZ, and they would bring fermented fish up from Seoul, wrapped in newspaper and packed in rice. And that was the only meat we had, and it wasn't bad tasting at all. They would drink, and it was healthy for you. They fermented cabbage, which was called kimchi, and it rotted in these pots for months. And in the summer it was a lettuce-type kimchi. In the fall it was a cabbage-type kimchi. Very hot, very spicy, but fermented, and very good for you. Their beer they drank was also fermented, and it was called makgeolli. It was a rice beer, looked like rotten milk, kind of tasted like that for a while. But there is definitely an advantage to probiotics, and you will see them most commonly prescribed if you've been in the hospital where you're around a lot of different bacteria, if you've had a surgery or a complication, that would require a heavy antibiotic. And when you get a heavy antibiotic, many times it destroys good bacteria as well as bad bacteria, and so you need to replace that probiotic. There's a huge difference in price between Floristar and some of the more active probiotics. I have taken the generic one off the shelf, and it seemed to be effective for me. As Paul said, there are side effects that you can be more nauseated sometimes from taking it, because it kind of affects the metabolic process or the breakdown of food in your system, as well as taking care of the bad bacteria as well. So one of the newer things that, again, not regulated by the Food and Drug Administration. And when the Dietary Substance Act took place in 1994, you saw all of these natural products that were not commercialized, put on the market with having to have any kind of a test done on them to see what their bioavailability was in the system, to see what their solubility was like in the system, how high they got in the bloodstream, how active they were when they got in the bloodstream, and whatever they put on the outside of the bottle didn't have to be proven by a chemical analysis. We still have that law into effect. You still need to be alert about buying the cheapest thing you can buy online, no matter what the drug is, and from a reputable company. For example, we don't buy anything from a company that's not FDA rated, not tested, but FDA rated. And most of our vitamins, I think all of our vitamins, come from a manufacturer that is backed by one of the major 3 wholesalers in the country. So it isn't always price. It has a lot to do with quality. Now, people will say they'll take a vitamin and they'll see it in their stool when they have a bowel movement. That doesn't mean it doesn't dissolve in your system. There's an enteric coating that goes around these pills, and sometimes in a capsule, where the drug is diffused through the membrane or the outer covering of that tablet or capsule. So it gets in your system, and the thing that's left is the shell. You'll see this many times with people who take potassium. It doesn't work. Or thyroid, they say it doesn't work. Well, you take a blood test and it works. So you're getting the medication, but just because you see the shell in your stool doesn't mean that you're not getting it through your system. So many things to consider as we get into this part of health that is starting to cost us more money because our doctor's insurance or our insurance doesn't pay for a lot of these treatments. And a lot of these things going from medication to tests, we wonder if we really need the tests that are being implemented or being requested. When you have a test that's many times we ask for an exam or a test because we want to see the results. Most times that is authorized by the physician, but sometimes it isn't. But more often tests are ordered for us, especially if we're in the hospital, that we really don't know if it has any effect or if we really need the tests. So they can be helpful when you need them. For example, there are times when x-rays or antibiotics or opioid painkillers may be necessary, and it's important for you to get them when they clearly will help you. But sometimes they recommend things that aren't needed, and sometimes they do it because their patients expect and ask for them. But before you get any kind of medical tests, you need to think about these 5 things and learn about the risks. Do I really need this test or procedure? What is it for? What are the risks and the side effects of having this test? Are there simpler, safer options? What happens if I don't do anything? How much is it going to cost, and will my insurance pay for it? And that becomes even more significant today because we have a lot of contract groups that aren't part of our major medical plan. So the anesthesiologist or the radiologist may charge you separately for the tests they perform, and it may not be covered under your insurance. X-rays and CT scans expose you to radiation. Is it okay? I mean, I've had so many CT scans and X-rays and tests because of my back. MRIs, antibiotics also can treat some bacterial infections, but they can have serious side effects. And lots of times when you get admitted to the hospital, they don't know what you have, and so they're trying to eliminate things, and maybe you don't have a choice. But these tests are expensive, and imaging tests like X-rays and CT scans and MRIs can cost you hundreds of thousands of dollars, and you may have to pay for part of that. Blood tests that, for example, you might have just had a blood test done by your physician and you go in the hospital and they redo it again. If it's been a short amount of time, do you really need that? Now, many times when we're admitted to the hospital, we're not capable of making those decisions, and we need to think about that before. For example, colonoscopies. You know, I had a colonoscopy when they diagnosed cancer. They missed it the first time. 6 months later, they caught it. I asked for the second colonoscopy. There's also a test that you can do with a stool sample that costs you virtually nothing, and then if it shows there's a tendency to have a problem there, then you go ahead and have the colonoscopy. Many times you take a test and you don't get the results. A doctor will order a pulmonary function test or a thyroid test or something like that, and they get busy, and the lab might send the results to the physician, but the physician doesn't send it to you. And then you're sitting there wondering whether you have a pulmonary problem, a thyroid problem, diabetic problems, or what. And you need to talk to your doctor about which tests and treatments you need and which ones you don't need. And the problem with that is you get into the hospital and your regular physician isn't ordering these tests, the hospitalist is. Does the hospitalist have the information from your primary care doctor or your internal medicine doctor or your cardiologist? And is this just a repeat of something that you've already done? Again, it's a matter of being proactive. I talked to somebody a week ago Friday at the concert that had been bitten by a spider, and they tested her for Lyme's disease. She didn't have that, but they didn't give her any antibiotics or anything, and it was becoming, it had been 4 or 5 days, and the bite was starting to look bad. And I told her that she suggested that she get into her doctor and see if there it wasn't an opening yet, but it was going to become an opening, and find out if she needed to take something. And you always wonder, do I really need antibiotics? Like strep throat and whooping cough and bladder infections, but they don't fight viruses. And like common colds, flu, or most sore throats and sinus infections, ask if you have a bacterial infection, because people will go in there with a lot of symptoms, and many times they're viral, not bacterial, and the antibiotics don't do any good, but build up a resistance to when a bad bacteria comes in, then they don't work. And of course they can cause diarrhea, vomiting, antibiotic resistance. Are there safer options? And of course all you need is rest and plenty of liquid many times. You can also ask about antibiotic ointments and drops for conditions like pink eye or swimmer's ear. Usually they're not very expensive, but if you get some of these that have become only 1 or 2 that aren't resistant to a lot of the bacteria, you don't want to take them if you don't need them. But when you take something, Keflex or cephalosporin used to be horrendously expensive. It's very inexpensive now. It's a broad-spectrum antibiotic. Amoxicillin many times. This person that had Lyme's disease that I met the other day went on amoxicillin right away. That's something that you need to do if they confirm that you have Lyme's, you were bit by a deer tick. That will eliminate a lot of the side effects that occur after Lyme disease becomes active in your system, and you may be treating for the rest of your life. So take them exactly as the doctor has told you to, and you've heard us tell you recently the length of time you're taking these antibiotics may not be nearly as important as it used to be. We're finding out shorter periods of time will give you a better chance of not becoming resistant to the antibiotic and be very effective. My story was always, if you take an antibiotic and you stop taking it when you feel good, it's kind of like pushing you off a cliff, because your body has not taken over on its own. The antibiotic is making you feel good, and then you drop it out of your system and your resistance drops lower than it was before, and you become more susceptible. Where that point is relative. Doctors mostly don't want to take the risk of getting you off too early, and I always tell people if they have antibiotics left in their medicine cabinet, get rid of them, because there's probably enough, not enough there to get them through an infection the second time around, and then they do become suspect if they only have 4 or 5. And of course, some people think they just work immediately. I took them and they're, I'm well. But you're really not. It's the antibiotic making you feel that you're well. So we talked about the people that were getting dementia as they get older, and there was a test done, a small test, that asked them to scratch and sniff test to identify strong aromas such as gasoline, bubblegum, and lemon. A third of those participants also agreed to participate in a test that would detect if they were at risk for the disease. The test showed that those with the most difficulty in identifying odors also displayed other indications of Alzheimer's disease. That's the first time that anyone's been able to show clearly that the loss of the ability to identify smells is correlated with biological markers indicating the advance of the disease. I don't want you to overreact to what I'm saying here, because as we age, a lot of our enhancements from the olfactory bulb, which determines smells, and The cortex, which is tied to memory and the naming of odors, are among the first brain structures to be affected as we begin to age. And those also are the places where we begin to be affected by Alzheimer's. But just because things aren't tasting as good as they once tasted, and your sensory nerves aren't as active as they used to be, part of that's the aging process. So just as we test ourselves all the time because we forgot where our keys are, or we parked at the ball game and don't remember where to go get our car because it looks like everybody else's, and that didn't happen to me, by the way, but it can. We need to be aware that everything isn't related to being struck down by dementia or getting things done that you normally can't get done. A lot of that's the aging process. So be aware that those things are kind of normal, and we need to, if the dementia process and the Alzheimer's process is becoming more active, and this, you've noticed this as an ancillary thing, it probably has something to do with the fact that you're progressing in that direction. Now we'll go to a younger group in the few minutes we have left. 4 kind of vaccines that you need for college. If you're a college student or soon to be one, making sure you're fully vaccinated is critically important. We talked excuse me, last week about people that weren't getting vaccinated and how that's become a big issue in a lot of the response to measles coming back, whooping cough coming back. A lot of these diseases that were almost non-existent are now coming because we're not getting vaccinated. But you're going to be living in a dorm or a fraternity or sorority house or other small space because large groups of people in close proximity are the right conditions for spreading diseases. Vaccines help students from contracting serious illnesses and keep them from missing classes. Keep in mind that your school's vaccination requirements may be not enough to protect you. You have to use good health standards at the same time. Follow the state requirements, which may not include the full list of vaccines recommended by the CDC. Bacterial meningitis is one of those. It's a meningococcal conjugate vaccine, which covers some of the most common forms of bacterial meningitis. That's a really devastating disease that almost always requires hospitalization and can cause permanent disability. Starting in mid-adolescence through college, there's an age group where that disease is most common, and that's the age where you're going to college. Pediatricians usually give you that vaccine at age 11 or 12 and a booster at 16. If you've missed either one of these, catch up before the move-in day in the dormitory. When it comes to vaccines for college, there's a second meningitis vaccine, a serogroup B, that prevents another strain. And since January 2015, outbreaks of the B strain have hit Santa Clara University, the University of Oregon. Even though it's not currently included on the CDC's vaccine schedules, people should get the serogroup B meningococcal vaccine. Pertussis, which is required for youngsters getting vaccinated going into the 7th grade in California. You routinely get vaccinated at infants and young children, and the booster recommends that kids between 11 and 12 receive a booster called Tdap. One thing I explained, because we had a little rush on people getting that vaccine, all these vaccines could be gotten at the pharmacy, but it's tetanus, diphtheria, and pertussis. The tetanus is one that you should always have every 10 years. Diphtheria is coming back in this country, and pertussis is whooping cough. Excuse me. And you need to get that pertussis shot, as we've said before. If you're pregnant, every time you have a child, you have to get that injected again. HPV, which is a sexually transmitted human papilloma virus, can lead to cancer of the cervix. It doesn't always have to be sexually transmitted. Only half of the males and 6 out of 10 females have completed this series by age 17. 2 doses are recommended at the age 11 or 12. If you didn't have the vaccines earlier, you need to get them. If you started the series after age 15, you'll need to get 3 doses rather than 2. It's been a while since your last dose. You can pick up where you left off. And of course, the last one is the flu. And I think that that class or that age group of people is probably affected more academically than any of the age groups, because they're so busy doing other things, and then they start missing class. And the seasonal flu vaccine can protect you from getting the flu. If you don't get sick, it may mean you get a milder case. Usually, as we talked about, it becomes available in late September or early October, but you might start seeing advertising now. If you attend college or are far from home, you should be able to get the vaccine in your campus health center, or you'll be able to at your local pharmacy, which is just as safe as getting it at your doctor's office. And if you have asthma, it's very important that you you get the shot. You're at a higher risk of developing upper respiratory infections that can affect the lungs and can affect your breathing. So we just want you to be aware. We have no idea how effective that vaccine is going to be this year. I will tell you that there is no intranasal vaccine again this year. Last year it was completely ineffective. This year, when they were bringing it out on the market, I don't know what happens to it that makes it ineffective. But again, this year they found out it was going to be ineffective, and they're not going to put it on the market again this year. So if you have a child that you wanted to give, and that was a live vaccine, you're not going to be able to give it. And if there are people giving it, you make sure you check the expiration date. And unless they have a special source that we're not aware of by the Center for Disease Control and the Food and Drug Administration, there shouldn't be any available to my knowledge. So we're winding down on summer now. The fair starts in a week or two. People are all going back to school. I think Kelseyville is the last one to go back, and it will be after Labor Day. So it's still time to get the shots that you need to get. A lot of colleges are in session already. Go to your health department and ask them if there's probably something on the market already that they have available for you to get you started. Not only is it the people that you're around, but the people you're exposed to on a regular basis. I'd like to remind you we're North Lake Medical Pharmacy with 2 locations for you, at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard. Give us a call there at 263-1328. Thank you, Paul.
Thanks, Bill. We'll see everybody back here again next Wednesday for Health Talk, right here, 10 a.m. on AM 1270 and 96.5 FM KXBX Lakeport.